Urolithiasis or renal calculi. Urolithiasis or renal calculi. Site of urolithiasis or renal calculi is kidney, most common site. The most common site of urolithiasis is kidney. Sex, males are more affected with urolithiasis. Age 20 to 30, most common age. Mostly unilateral and multiple. Urolithiasis is mostly unilateral and multiple. Predisposing factors: increased concentration of stone constituents, increased concentration of the stone constituents, change in urinary pH, decreased urine volume, presence of bacteria, deficiency in the inhibitors of crystal formation, increased concentration of the stone constituents, changes in urinary pH, decreased urine volume, presence of bacteria, deficiency in inhibitors of crystal formation. Classification: calcium salts are most common. Composition of calcium salts: calcium oxalate or calcium oxalate mixed with calcium phosphate. Composition is calcium oxalate or calcium oxalate mixed with calcium phosphate. Causes: idiopathic hypercalciuria is the most common cause. Idiopathic hypercalciuria is the most common cause. Hypercalciuria and hypercalcemia seen with hyperparathyroidism. Hypercalciuria and hypercalcemia seen with hyperparathyroidism. Hypercalciuria and hypercalciuria and hypercalcemia seen with hyperparathyroidism. Diffuse bone diseases and sarcoidosis. Calcium stones are most common. Composition is calcium oxalate or calcium oxalate mixed with calcium phosphate. Causes: idiopathic hypercalcemia is the most important cause, is the most common cause. Idiopathic hypercalciuria. Hypercalciuria and hypercalcemia seen with hyperparathyroidism. Hypercalciuria and hypercalcemia seen with hyperparathyroidism. Diffuse bone diseases and sarcoidosis seen with hyperparathyroidism. Bone diseases, diffuse bone diseases and sarcoidosis. Magnesium ammonium phosphate stones or triple stones or steroid stones. Magnesium ammonium phosphate stones. Magnesium ammonium phosphate stones or triple stones or steroid stones. Magnesium phosphate, magnesium ammonium phosphate stones, triple stones or steroid stones. Magnesium ammonium phosphate stones, magnesium ammonium phosphate stones or triple stones or steroid stones. Causes: infection by urea splitting bacteria with alkaline urine. Infection by urea splitting bacteria like protease with alkaline urine. Infection of urea splitting bacteria with alkaline urine. Example: staghorn calculi. Example: staghorn calculi. Uric acid stone causes hyperuricemia with gout and leukemia and acidic urine. Uric acid stone causes hyperuricemia with gout or leukemia. Hyperuricemia with gout or leukemia and acidic urine. Uric acid stone causes hyperuricemia with gout or leukemia, hyperuricemia with gout or leukemia and acidic urine. Cystine stones causes cystinuria and acidic urine. Cystine stone causes cystinuria and acidic urine. Morphology: stones may have smooth or spiculated surface. Stones may have smooth or spiculated surface. Stones may have smooth or spiculated surface. Cystine stone causes cystinuria and acidic urine. Morphology: stones may have smooth or spiculated surface. Cystine stones may have smooth or spiculated surface. Staghorn calculi. Staghorn calculi are massive stones with branching structures. Staghorn calculi are massive stones with branching structures occupying large portions of the renal pelvis. Staghorn Staghorn calculi are large stones with branching structure occupying large portion of the renal pelvis. They occupy large portion of the renal pelvis. They are usually composed of magnesium ammonium phosphate. Staghorn calculi are usually composed of magnesium ammonium phosphate. Clinical presentation: asymptomatic, may cause renal colic, abdominal pain, or hematuria. Asymptomatic, may cause renal pain, hematuria, or abdominal pain. May cause renal colic, abdominal pain, or hematuria. May cause renal colic, abdominal pain, or hematuria. Complications: secondary infections with urinary tract obstruction. Complication is secondary infection with urinary tract obstruction.